I just wanted to welcome you all and thank you for joining tonight, or this morning for some of us. Um, of course, hopefully you still know me. I'm Nigel, audiologist and director at Hearing Institute. Really great to see so many familiar names and faces attending tonight. And tonight's session really does serve as both a masterclass and a refresher, reinforcing some key information that we may or may not have discussed with the sessions we've had in the hearing aid fittings. We're very lucky and very pleased to be able to introduce Dr. Fabrice Bardy, who will be presenting tonight. His co-founder Matt's in the background, and he's hopefully going to help facilitate the session. MindEar is a therapeutic product that has been designed to support and manage tinnitus. It's really been an integral part of our referral system for some time now, and it's been delivering some really excellent results in tinnitus management. The information tonight really will be covering some of the key aspects of tinnitus management, helping to refine some of the strategies that we may or may not have discussed, and really reinforce some healthy and holistic techniques in tinnitus management. Of course, if you need any additional support, we're here to help. As Fabrice mentioned, tonight we will have or try and have a Q&A. So I do encourage you to post questions or put your hand up electronically. That way, then we can try and facilitate that process. But of course, if there is any feedback, if there are any questions that aren't answered tonight, you can post them through in our feedback form, and it will be really good to be able to answer those questions. Further, I do encourage you all to explore and find the MindEar app. It's available on all platforms. It's really a very useful app, even if tinnitus is one of the things, but not the main thing that I've seen you for. It's got some great free strategies that can really help reinforce some of the strategies in tinnitus management, but also healthy living. I guess I will also say that if there is any additional information you need, of course, you can always book a follow-up session with me. I'm also very interested in helping people answer questions, and certainly I work in a strong partnership with MindEar, and MindEar works with a number of practices globally, and particularly in Australia and New Zealand. I can refer and facilitate referrals through to some of the programs that MindEar runs. These are paid programs, but these programs are very good for anyone that really is struggling with tinnitus. Okay, well, look, I think I'll hand the mic over. So I'm very pleased to introduce Dr. Fabrice Bardy, who will be, as I said, supported by his colleague Matthew tonight. And I'll, of course, chip in and answer some questions along the way as we need to. So, Fabrice, I'll pass the microphone over to you tonight.
Thanks a lot, Nigel. Thanks a lot for the introduction, and very nice to meet you all. I will try to share my screen, and here we go. And you should probably be able to see. Here we go. And yeah, so like with my co-founder Matthew, we developed the platform already quite a few years ago. Started from some validation, clinical validation at the University of Auckland. And today we are very happy to make the platform available to the largest number of people around the world, and especially in Australia and New Zealand. And really, if there's one message I want you to remember at the end of this masterclass, is like, in case you have been struggling, in case it's been challenging for you with tinnitus, it's really important for you to remember that there's things that we can do in order to make that tinnitus is not as bothersome. There's things that we can do, and generally we're going to learn today. The first step is basically to understand how things works and what are the options. We're going to see that and then I'm going to talk about the agenda. We're going to talk a little bit of the profile, what it means to have tinnitus and why there is different kind of tinnitus. Tinnitus is a symptom that can be impacted by a lot of different things. And we're going to learn a little bit more what are the association between tinnitus and other symptoms. I want to talk a little bit about the anatomy of the hearing organ, and you're going to see that sometime when we understand where the lesion, the site of lesion happen, it can give us some better, um, it gives us understanding what's happening, can help us to first um, accept also what is accept the, so understanding the site of lesion is like a first step to acknowledge of what is happening, and it's going to help us in accepting and move on the recovery stage and the recovery journey. We're going to talk about the recovery journey also, and that you're going to see that it's not something that is instantaneous. It takes time, but it's possible. And with the right tool, you're going to see that we're going to be able to get to a point what that we call habituation. And habituation is the stage where even though we did not eliminate tinnitus, we can decrease the amount of time we focus on it to the point where the sound fall in the background in a place where it's not bothersome. And I will talk about the MindEar program and explain how the MindEar program can help you to achieve this recovery. So at the end, the goal is for you to understand the journey to recovery and the different stages, and to help you understand also what are the different tools available in order to get to the point where tinnitus is not bothersome. But to start with, I would love to hear, and then I will try to make this and masterclass as interactive as possible. And I would love to sort of understand for you how tinnitus is impacting your life. And so, in this question, I would like to know in the last 7 days and the last week, on a scale from 0 to 10, where 0 is not bothersome at all and 10 is extremely bothersome, how you feel impacted by the tinnitus. And I will share that, and it will help us to understand that there's a variety of ways that tinnitus can impact us. But it's also going to help me to tailor my talk to you as a group. So I'm going to wait a few more seconds. I can see that is already great. We nearly get 80% of you answered. Uh, Excellent. Like everybody is very active. That's lovely. Great. So I'm going to now end the poll and share the result. And you can see that on a scale from 0 to 10, there's a very large distribution about how tinnitus is impacting our life. And it's going from 10, where we got 7% or 2 out of 28 people who are really finding it extremely bothersome. And we go down all the way to 1, where tinnitus is not bothersome at all. We see that there's probably a larger number of people where the 2, so we get 18% of people who have like basically selected 2, and when we get like 4 and 5, where we also get like 21 and 18%. So in this group, like we feel that the majority of you are at a level below 5, which is amazing. I want to reassure that anybody who is at a level between 6 and 10, that is going to be possible to decrease how bothersome is a tinnitus. So it just shows that we are all at a different point in the journey to tinnitus recovery. And independently where you are, I want to reassure you that it's possible to bring that to a 2 or even a 1, a 2 or 3. And meaning if you have like a 8 at the moment, we will be able to get to a point where tinnitus is present, but tinnitus is not bothersome and tinnitus is not impacting your life. So thanks a lot for sharing that. And we're going to sort of like now dig a little bit deeper in terms of what tinnitus is. Um, it's a symptom and it's a sound that we hear, but which can be impacting us in different ways. And you can see here on this slide, so that there is like different symptoms like anxiety, stress, depression, sleep difficulty, attention, negative thoughts. And then we got in red, we got two elements that we might already have discussed with Nigel, which is hearing loss. And then there's a large association with hearing loss in the sense that 75% of people who experience tinnitus also have a damaged hearing organ. And we will look a little bit further about what it means and why you might have already been getting some support through a hearing aid. And in the majority of cases, being able to receive rehabilitation through a hearing aid is already going to help with the tinnitus. The hearing loss component is what we call the cochlea, or like the cochlear component. So it's like the hearing organ component. Then below, we have something which is called somatic tinnitus, and generally it's linked to tension in the jaw or tension in the neck. And this is really the second subtype of tinnitus. The third subtype of tinnitus is what we call central tinnitus, and it's where it's going to be including anxiety, stress, depression, sleep difficulty. And in the sense, there's going to be higher center in the brain who are going to control. And this, in many cases, there's a bidirectional relationship in the sense that tinnitus can include that can induce some stress or can induce some anxiety, but also anxiety and stress can impact the level of the tinnitus. With Nigel, you've really been working probably a lot on this aspect, the hearing rehabilitation. And we're going to see that today I want to show you technique or strategy which are going to help you with these other symptoms that can be associated with the tinnitus. And it's where we develop a program at MindEar in order to help you with this other component. But now I'd like to ask you another question also, and it's linked to the tinnitus profile. So we saw these different symptoms, and I would love to understand how you feel impacted at the moment. So you should be able to see on your screen the different symptoms that I mentioned earlier. And if you can select more than one or multiple symptoms because it's often the case where we experience more than one. But again, it's going to give us all an idea about how, as a group, you feel impacted by the sound you hear. And it's going to be very interesting to understand because it's going to help us identify which treatment option you can potentially use in order to decrease the symptoms. That's great. We get 85% of you already answered the questionnaire. I'm going to wait another second and then we'll share the result. Great. So that's amazing. Thanks a lot for being so active tonight. It's really, really nice. Great. So, and not surprisingly, here we go. You should be able to see on my screen. And can I can you see on my screen? Yeah, you should be able to see on your screen the result. Yeah. But the majority of you have a hearing loss, or what we call a cochlear dysfunction. 57%. And it's probably the reason why you saw Nigel in the first instance, in the first place. But you can see that there's a lot of other symptoms which are associated. And the second one is increased stress and anxiety. And that's very common. We see that there's 50% of you who have a link to stress, or where stress can impact tinnitus, or the opposite way around, where tinnitus can make you a bit more stressed, make you more anxious. And we're going to see that there's strategies, there's treatments that can help us to decrease stress. And the impact of that will be that with time, you're going to feel less bothered by the tinnitus. Um, then we got trouble concentrating attention, which is also often a very common symptom. Uh, Negative thoughts, which can be linked to the stress and how we feel. And we're going to see that inside in this masterclass, there's probably three elements here. So first, we want to understand how things works. It's really important. We want to also get acknowledged that that it is a problem and that's been impacting your life. And in this sense, we really want to sort of acknowledge that this thing that we've been hearing has been impacting us, but there is ways to get to a place where it's not impactful or not bothersome. And the last thing, which I think is really important, is recognizing the power of our brain and the power of our mind. And we're going to see in this presentation that our thoughts are often linked to how we feel. So in case we have negative thoughts linked to the tinnitus, it can potentially impact our emotion, can impact how we feel, and it can impact our life. And we're going to see that using strategies that help us to decrease or change our thoughts into something more neutral, at least if they are negative, is going to be helpful in order to decrease the impact of tinnitus. And then the other symptom, we can see sleep difficulty, 18% of you, and somatic component, 11%, which is also something that you're going to be able to where you're going to be able to find resources inside the MindEar app or the MindEar group coaching session. So I'm going to stop sharing. Before we, sorry, to reduce that. Before we move further, I just want to show you a few images that shows how the ear works. And you can see on this image, we get to see the external part of the ear, where the sound enter the ear canal. It's reaching the eardrum, and so there's three ossicles which are transmitting the sound into what we call the hearing organ, which is called the cochlea. And from the cochlea, you can see in blue, there is like some arrow, which shows that the signal is transferred. This is what we call the midbrain, and initially the brainstem and the midbrain, and then it's going up to what we call here the primary auditory cortex, which is the first place in the brain which is going to process the signal at a cortical level. And from there is going to be transferred into other higher center area in the brain where we're going to be able to take decision depending to what we hear. We're going to see first that generally there's a lesion inside the cochlea, and it's where I'm going to zoom in. So I'm going to zoom into this snail here. And this is like a very fascinating organ that we call the cochlea, which is 3.4 millimeters large. So it's a very tiny, tiny organ. And this organ is basically inside this organ, we got here some very tiny cells that we call the air cells, and you can see them, they have a V shape. As these air cells can potentially be damaged either because of aging, either because of some exposure to noise or some ototoxic drugs that we can that we might that we have taken during our life. And what it causes, basically, this hair cell can be damaged. And generally, inside the cochlea, if this hair cell are damaged, then it's going to be what we call a hearing loss. And that might be the things that you have been doing with what we have been doing with Nigel. We took some hearing tests. So you might have an audiogram, and Nigel might have been taking some DPOAEs, which is like an electrophysiology measure to measure how healthy these cells are. And in case these cells have been damaged, then there's going to be a problem of the transfer of the signal. And that's what I'm going to show later on. If the hair cells is not present anymore, or if it has been overstimulated, um, we might have a problem of transmission of the signal here where the button, like this is some synapse, where if there is an increased concentration of neurotransmitters there, it might be damaging the synapse, the receptors of the synapse. And in case this is disappearing, then a signal might be transmitted in case of even though there is no activation of the hair cells. And in this case, we might then basically get to hear a signal, which is what we call the tinnitus. And this signal might be present, and then it might become bothersome. When we initially hear this signal, it's very normal to be scared and be afraid about what it is because of the lack of, we might not know what it means. Is it like a sign of something very, is it a sign of something very, that is going to sort of like be impacting our life, or like is it a medical condition which is going to impact our life? And then there's a lot of questions that we might ask ourselves. In this graph, I'm going to show you that there's different stages in the journey with tinnitus. Generally, the first phase is awareness, and this is when we basically start to hear about the condition. Which generally is that's going to be the Google time, the time where we basically look online and say, what is tinnitus? How I'm going to, what does it mean for me? And then the more we look, and sometimes it can be very scary because we can read some very dark story which are not a reflection of the normal of what this condition is. In this phase, you might have been, and the good thing already is like you have been able to talk to Nigel, and Nigel might have been able already to reassure you and tell you what this is. Generally, the second stage is going to be when we have a symptom like tinnitus, we try to fix it initially, in the sense that it's very natural we want to find a solution, something that is going to get rid of it. Currently, there is not a cure, meaning that there is no way to basically get rid of the signal. But really importantly, there is a way to help the brain to stop focusing on the sound. And you're going to see that by allowing your brain to focus on all the things that are important for you in your life, slowly you're going to get to a point where the tinnitus fall in the background in a place where it's not bothersome. The more you're going to fight it, the more it's going generally to come back to you. And we're going to see that in the second phase, which we call allowance, we're going to see that accepting the presence of the tinnitus is generally going to be the best place in order to basically decrease how it's impacting your life. In the graph, you can see that there's ups and downs, and generally this path is not really linear. It's the sense there's going to be good moments, there's going to be moments where it's a bit more, where it's harder, and we will need to accept that there's like this variation in terms of how bothersome it is. Sometimes there's days where we feel good, there's days where we feel that it's worse than before, but we need to remember that during this journey, it's generally going to improve all the time. Even though it feels like it's getting worse, actually it might just be a microcycle where we feel that the sound is impacting us more, but it's generally going to change and getting to the point where you feel that it's getting actually less and less impactful for you. third stage, and I will talk a bit more actually in the following stage, in the next stage, but you're going to see that we're going to get to stage 4. And stage 4 is a place where tinnitus is not bothersome. And I want to reassure everybody who is in this masterclass. So we saw that for some of you, it's already the case. And some of you were probably more at the beginning of a journey. But I want to reassure that all of you, it's possible to get to the level 4 where tinnitus is not bothersome. And we are here to help you to get there, and giving you the technique and the strategies that are going to be able to apply in your life in order to get there. So in the next slide, I want to get back into this stage. So first stage, awareness, is where we start, where the sound is really annoying, very distressing, and we are with a stage where we're searching for information. Stage 2, allowance. It's the stage where we start to recognize that the sound we hear is harmless, or that it's a benign sound. And I want to emphasize the term benign sound because I think it's really important. When we identify that it's a benign sound, then we suddenly see that we might not need to monitor it, and we might be able to start to get some distance. So we might start to accept that the tinnitus is part of our life, and we progressively going to stop the fight. It's probably the most challenging stage during the recovery. It's tough because initially it means that we might need to change our mindset, and you're going to see that changing your mindset will probably going to help you to go through this stage. Stage 3 is going to be where you start to acclimate. So you start to adapt to the tinnitus and become less and less noticeable or less bothersome. And finally, stage 4 is going to be the stage where you feel that you are back in control and you know how to manage your reaction to the tinnitus. And it's a stage where it's no longer causing distress or it's not interfering with your daily activity. And it's really where we want to get, where we, all of you, where it's possible to, the stage where we want to get for all of you. So now, for that, I have another question for you. And so let me find it. Okay, that should be now on your screen. So I would like to ask you, in terms of stages, where you feel you are at the moment. Great. Excellent. Perfect. Really good. Thanks again for being so active. It's really, really interesting result. And you can see that when you talk to someone who has tinnitus, you might be experiencing the same symptom, meaning hearing a sound, but you might be at a very different stage in your journey. And it means that it can be very difficult to compare yourself. And I will suggest that you try not to compare yourself to your neighbor or someone else who has tinnitus, because they might be in a very different stage in their recovery journey. Anybody, and they say 7 out of 28 here, so 25% of you who are in this first stage, which are in this awareness stage, congratulations for being in this masterclass, because finding the information and being here is going to be the first step in order to get to stage 4. It might be very challenging today, but you're going to get better. And you're going to, by getting access to the right information, you're going to be able to move forward faster and get to stage 4 as fast as possible. It might still take a few weeks, a few months, but you already know that there's a journey. You already can identify that there's things that you can do. For people who are in the stage allowance, it's a challenging phase. So being able to get to the point where we can accept the presence of the tinnitus in order to really decrease the fight is going to be, it's a challenge, definitely, but it's something that you're going to see also with the right technique and the right tool, you're going to be able to pass. Once you get into this mindset, um, into a mindset where we don't fight the sound, you're going to see that suddenly your brain is going to be able to evolve and your reaction to the sound is going to change. And then acclimation and achievement phase, well done for people who are already in this phase where you feel that you're able to sort of slowly decrease the impact of the tinnitus. And for the people who are in achievement phase, that's great. That's like, it shows everybody within this class that it's possible to get there. And so that's really important that there's light at the end. If you feel that you are in this dark tunnel, there's light at the end of the tunnel. And it's important to remind yourself that you're going to get there. But thanks a lot for sharing. And it's really important, I think, to identify that we are all at a different stage, but we are all going the same direction, and we all want to get. Oh, and sorry, I was not sharing my slide, I think. So I was not sharing the result, but this was the result. So it was basically a distribution of the result where around basically 25% of you were in each different stage. And so it's thanks a lot for sharing that. Now I want to talk about habituation. And this is like basically showing you how things are progressing. And I'm going to focus on describing this graph, which is on the right. Over time, when you're going to progress during the different stage, you're going to see that there's going to be a variation of the sound. And in gold, this gold color, you're going to see that the sound is you're going to have days where it's louder and days where it's softer. And there's going to be variation. Over time, you're going to see that this sound might not going to change in the sense that the tinnitus might still be present, but in green, what you see is like the reaction to the sound is going to decrease. And it means that even though the sound might be at the same loudness, the reaction to the sound that we hear is going to decrease to the point where when you're in stage 4, you're only going to think about the sound once in a week or once in a month, but very rarely, and it's not going to impact you. And so that's really important to dissociate the sound itself into how it's impacting our life. And you're going to see that the goal here is really to allow the sound to fall into the background. So now we talked about the different journey, the journey in order to basically recover. And now we'd like to spend the next, and there's 7 minutes before we get into the Q&A, about the techniques that we can use in order to get to stage 4. The treatment option which has the most evidence from a scientific point of view in order to help is cognitive behavioral therapy. And some of you mentioned that you're impacted by stress, you feel more anxious, or that you have negative thoughts. CBT is going to be a great option for you to get better and to minimize the impact of your thoughts on your emotion. We use mindfulness and relaxation, and mindfulness and relaxation are also going to help in order to make that reaction of the body to the signal you hear is minimalized. We talk about sleep and sleep. It was interestingly, generally in this group, only 11% of you were mentioning an impact of tinnitus on sleep, which is great. Generally, it can be slightly higher. And it means that inside the MindEar program, we also have a sleep component where we try to help you get into a good sleep. And we know that sleep impacts our life more broadly, in the sense that a good night's sleep is going to make that you feel more in control during the day, easier to focus, and so on. Jaw and neck tension, it's really important. So we try to identify here, same, only 10% of you were mentioning like tension in the jaw and the neck. But for you who are experiencing, then we have like masterclass. We explains why tension in the neck or tension in the jaw can have an impact on tinnitus, and giving you exercise that you can do in order to relax. And then we talk about sound therapy. Sound therapy is something that Nigel has already been involved via hearing rehabilitation through hearing aids, in the sense that exposure or reintroducing sound for the part of the cochlea which is damaged is really important in the rehabilitation process. And the way it works, by reintroducing sound, we are going to decrease the contrast between the tinnitus sound and the sound environment where you are located. And by decreasing the contrast, you're going to feel that the perception of the sound of the tinnitus sound is lower. So the goal here of the program we created is really first to decrease the fear, and making sure that we recognize the sound as a benign sound. It's really probably one of the most important aspects. Being able to make sure that what we are experiencing is not something dangerous, and it's not something that is going to harm us. It's really, really important. We're going to promote relaxation and help you to develop stress management technique, or give you access to techniques that help with stress management. We trying to help you with improving sleep, and we're going to help you to understand grief. And for most of us, we feel that we lost something which was really important in us, which is silence. And it's really important to understand that there is different stage in this process, in order to feel that we can accept that this is our new version. What is it's often that we normalize what is normal hearing, or what is normal. The way we were hearing before is often the way we think it's normal. And recognizing that this is our new normal is going to be a really important step in order to recover and to get better. The knowing that in this grief process, there's going to be a phase of denial where we don't want to acknowledge that this is happening. There's going to be a stage of depression. There's going to be a stage of acceptance. And then when we get through this phase of acceptance, then we're going to start to feel better. But we are also here in order for you to, you can basically express also all these emotions that have been going through your mind. And sometimes just being able to express that with other people who are in the same situation can be very powerful in order to recover. And then acknowledging that in order to get to stage 4 is going to require resilience. It means that it's a process, it's not immediate, but with time and by engaging in some of these activities, that you're going to see that step by step, you're going to be able to regain control. And we are here with Nigel and the team at MindEar to support you in this journey, in order to be able to be on your side when there is bad days, when there's days where you feel that it's challenging. So the way we work, we basically have the MindEar app, and I did already put a link inside the chat. But we also have group coaching session where we meet every second week. It's on Thursday at 7 p.m. for 1 hour, and where we're basically going to talk about one specific subject. And we're going to try to find solution together. So I'm going to present you with strategies, techniques that you can basically implement. But then you're going to be able to talk with other people also in order to find ways together about how to maximize the impact of this technique. We want this group session to be very supportive, and it's really important that together we can get there. And sometimes being in contact with other people who have been experiencing the same symptoms can make you feel that you are not alone in this journey. And sometimes it can be very difficult, very challenging to make other people understand what we go through. So it's a 12-week program, and during this 12-week, we try to help you getting access to the maximum number of knowledge in order to get to level 4. And if you're interested to basically learn more about this technique, please contact Nigel, and Nigel will be able to give you, and Daniel, which I think is inside the school, and Daniel will be able to help you identify how to register to the program. The program is something that we developed in collaboration with quite a few universities around the world. So we started in Auckland with Professor Susan Purdy, who is at the University of Auckland. But we also have other clinical trial running in the UK, at Leeds Trinity University and at UCL Hospital. And that was developed in collaboration with audiologists, psychologists, and also physiotherapists. This is a team at MindEar. The app, so there's a link inside the chat, and Nigel will send an email afterwards with also like a link so that you can download the app. It's really give you access to all the tools. There's a lot of information there, and something that you can do anytime. Meaning that if you feel stressed at 2 a.m. or feel that you have negative thoughts and it's really hard to fall asleep, then you can use it to either play some relaxing sound, engage into some meditation, or potentially do like some cognitive behavioral therapy exercise. So it's in your pocket anytime, anywhere. And it's the reason we developed it. It's like to make you give you access to technique at any time. And to give you a nice, this is basically was like one of the first one of the first participants that one of Nigel patients who basically joined the program, where we were able to really get some amazing results. Like in this, there's a lot of graphs. I just want to focus on the tinnitus functional index, and tinnitus functional index give an idea about it's a validated questionnaire that give access to the severity of the symptoms. You can see 72 out of 100. So it's a pretty high score. And after 12 weeks, we were able to reduce. So 72 is like, it's in the category a big problem or very big problem. And then we were able to reduce after 12 weeks into 25, where it became a small program. This is a massive improvement. For example, and meaning like in your scale, the initial scale from 0 to 10 is basically being able to get from a 8 to a 2 or a 3. And being able to be in a 2 or a 3, meaning that the sound is present, but the sound is not bothersome. And for this case, so we monitor, for example, the different subscale, if there is like, if it's impacting us more for in the auditory domain or in the relaxation. And in this case, it was sleeps, in the sense that we still needed to get we needed to get more treatment done to improve sleep. And we can basically, at the end of the program, decide if there's need for more support. This is a testimonial. I will not have time today because I would like to get a few questions answered. But so if you're interested, you can either try to contact Nigel to join the 12-week program. And I can see some of the people here in the room who have already been part of the program, who could nearly give us their their view about how it has been able to help them. And so otherwise you can basically also download the app, and this is more do it on your own. And it can also give you still access to the tool that can help you get to level 4. So thanks a lot for your attention. It's probably a lot of information in a short amount of time. But if there's one thing I want you to remember is like there's a way to get better. It's about finding this tool. It's this tool that's going to work for you, or potentially not going to be the same tool that is the one that's going to work for your neighbor. But what we're going to present to you is going to be a toolbox, and you're going to be able to test and see if these tools basically help you to decrease the way it's impacting you. And step by step, by identifying the tool that works for you, you're going to unlock different stage in your journey to the point where you feel in control again. So thank you for your attention, and then I would love to see if we can answer a few questions. And if you have any question, feel free to write them in the chat.
Many thanks, Fabrice. I'll take over for a moment and just thank you for the lovely presentation. It's a great refresher. That's great additional information, and as you said, a lot of ground's covered tonight. I just want to reiterate that the presentation discussion tonight is being recorded and it will be sent out. Danielle will send that out in the next day or so. And of course, I do have some questions which I'll just raise. And if there are questions that you have that come to you at a later time, then please do send them to us and we'll be happy to help and answer those questions. The app is there's a free version, so you're very welcome to please download that and just have a look at it. It's an easy app to navigate. It's well presented app, and the I guess interface is very nice to use, particularly at 2 a.m. in the morning, Fabrice. The program is certainly worthwhile, and if you do feel that you're on that journey and you feel you need that support, there is a structure which is supportive, which is personalized, which is really elicited some very, very positive results. And certainly for myself, my colleagues, we've all had some great experiences with MindEar. So, look, Fabrice, thank you very much for that presentation. Couple of questions. I'll just put the first one to you. I have here in the chat, and really it is around the fluctuations in tinnitus. Why is my tinnitus loud many times and not so loud sometimes? Fabrice, do you want to give some? Yeah.
So that's very something that it's very common. So first, and you might have seen in the graph about habituation, this fluctuation of the level of the tinnitus, meaning that it's probably something that anybody in this room might experience. Small variation for some people, larger variation for all others. There's multiple reasons that can basically cause a variation of the loudness. One of the reasons which is relatively well understood is stress level. So interestingly, if we look at the relationship between stress and the tinnitus sound, we can see that stress can increase probably in the neural pathways. Is like and generally when we look at the central auditory nervous system or the nervous system more broadly, there's two things which are really important. There's activation, so excitation part, and the inhibition part. And generally, the way we basically think about the pathways, like how the sound is impacting the auditory system, which is sending the signal to the brain, and the other pathways, like how the brain is impacting, going down and basically inhibiting, stopping the signal to be presented. And generally, we see that there's a change in the balance between these two systems, which can basically make the variation of the sound loudness. I'm talking about stress. It can be other factors. Uh, the other factors sometimes, so some of you might experience, for example, coffee or like when you're drinking coffee, that there's an increase of the loudness of the sound. Might be for others that it's not the case, and it's most of the case for uh, alcohol. Some other people will basically mention alcohol is having like an impact on the loudness. But what I want to say here is like it's very personal. So even though at the scientific level we can see some trend, for example, with stress, which seems to be one of the trends which is well understood, there's a lot of different ways we can be impacted. And it's going to be very challenging to really pinpoint which element is going to increase, like, or make that there's an increase of the tinnitus. At the end, it's going to be really important to acknowledge that there's an increase and a decrease, a variation, acknowledging it, and making sure that you are not worried when there's an increase of the loudness. Because when there's an increase of the loudness, it probably means that in the following days, you're also going to experience a decrease. And so when you experience, and it might be the case for everybody, but how do we find techniques that helps you to reassure yourself that even though it felt louder, it doesn't mean that it gets worse? And during the course, what we try to do is really helping you to identify the techniques that help you to reassure yourself in case this happens. And when you get this reassurance, and we get to the point where you see that, okay, I acknowledge that it's louder, but it doesn't mean that it's stopping me to do anything that I want to do today. And you're going to see that the power of the mind and the power of the way you think is going to be able to counteract and make that at the end of the day, this sound that you hear is not going to impact your life. So understanding that these variations are appearing, yes, we might not all the time understand why, but at the end of the day, we might really importantly understand that we can still control the way it make us react, and making sure that we feel that even though it is louder, it's not something dangerous. It's still a benign sound, which is not going to impact our life. Is going to be really an important element in order to make sure that you still can filter out the sound with your brain.
Thanks, Fabrice. I've got one other question here. This is a curly one that I get all the time. Do people without hearing loss experience tinnitus?
Yeah, so that's a thanks for this question. I mean, it's quite um, so there's like different level here, and probably so when we do a hearing test, we got some hearing instruments which are sort of like been designed. For example, when we measure hearing loss, we use like what we call an audiometer, which basically sends frequency to a certain specific range. Um, Generally, the frequency that we measure are being um, used in order um, to do hearing rehabilitation. So it means that we basically test this frequency that we know are important for speech, and generally from 120 or 250 hertz to 8 kilohertz. And many times, if you go to if you take a hearing test, and I know that Nigel do some higher frequency testing also, but there is certain case where we can't basically, we don't have the right measure in order to test the hearing dysfunction. So it means that it might still be some sort of lesion inside the cochlea, but it might be that the test that we use are not sensitive enough in order to detect where the site of lesion is happening, if it makes sense. So that might be a case. And then there's other case where we talk more about what we call central tinnitus. And in this case, generally, it's what I was talking about earlier. We see that the nervous system is very, there's like a, what we call that stochastic activity, which is the neural firing randomly at different time. And that's random activation of the nerves is actually something which is very normal. And in certain case, we can see that there's an increase of this neural activity, which can be impacted by other factors. And here is where stress, basically, stress, anxiety, all the symptoms, which can really have or modulate this activity inside the nervous system or inside the auditory nervous system. And what I was talking earlier is like generally a change in the balance between the activation and the excitatory system and the inhibitory system that make that suddenly there's a more of an increase of the baseline activity that can create tinnitus. And the sound that we hear can be a reflection of this change in the balance inside the auditory, inside the nervous system. So it's not rare to see that some of you might experience tinnitus, even though you might or we might not have diagnosed any hearing loss or hearing damage. And in this case, what is great to know is like our brain is going to be able we're going to be able to secrete the right hormones. And our goal here is really to found the balance again, this balance again between these two systems in order to get to a level where the baseline activity is decreased and where the sound can basically be reduced. And that's possible. So thanks for this question. I think it's definitely a challenging one. We cannot always answer precisely, unfortunately, because of the lack of measures that about the site of lesion. But in certain cases, though, we can still understand using the questionnaires what are going to be the treatment option which is going to help the most.
I'm sorry, I'm going to have to cut the. I've got about four other questions, and we can answer those individually. And I'm sorry that I have to cut this because I know that Fabrice has to go and give lectures and work at his university. Look, again, thank you so much for joining us tonight. I really do appreciate the support. We've had a lot of people ask for this type of seminar. There will be more to come, and we really hope that you'll be able to attend, and we will be producing some new and different topics. Thanks. Good night, everyone. Thank you, Fabrice. Nice to see you
Thank you,
all.
everyone. Thanks a lot, Nigel, for inviting me. Have a lovely evening,
Thanks.
everyone. And thanks a lot for everybody to join tonight. It was lovely.
Thank you, everyone.
Bye-bye.
Bye. Bye.